Hello, everyone. Thank you so much for joining us tonight. We're super excited to host today's webinar all about egg freezing at Ovum Care. Before we get started, I'd love to know where everybody's tuning from. What's your home country? Because I know we have a lot of international spread here, so feel free to put it in the chat where you're coming from, your city, your country. Let me just open the chat, and then you can put where you're coming from. So we have someone from the UK. Nice. Someone else from Egypt. Great to have you here. We have Berlin, Germany, New York, US, Paris, France. Very nice. Dubai. Amazing. Well, thank you so much for joining us tonight. We're super excited to have such an international audience here. Before we start, quick introduction. My name is Leslie. I work on patient satisfaction at Ovum Care, and I will be your MC this evening. And I am pleased to have Dr. Lynae Brayboy with me, co-founder and chief medical officer at Ovum Care, who will tell you all about egg freezing. Before we kick off, just on the next slide, a short disclaimer that we'll be giving you a lot of great information tonight, but that should not replace any individual conversation with your doctor. And before handing over to Lynae, I will like to share a few words about Ovum Care. So at Ovum, our mission is to empower every human that seeks to build a family to become a parent. And we want to do it in a way that is successful, democratized, and convenient. And for this, we leverage technology that will allow us to build a personalized treatment plan that will fit your reproductive goal and also assess equality before we freeze your eggs. We also offer transparent pricing that allow for a reduced cost with flexible payment option that will fit your financial needs. And finally, we make sure that you are continuously supported throughout your fertility journey with us, so you will have access to our care team and our treatment plans 24/7 via our patient app. Regarding where we are located, so our first clinic is located in London in the United Kingdom, and our second clinic will open very soon in Portugal, near Lisbon, and will be ideally placed between beaches and natural park and the city of Lisbon to enable you to have a relaxing experience with us. So without further ado, I'll hand it over to Dr. Lynae, who will tell you a bit more about egg freezing, the science behind it, and our approach at Ovum Care. And we'll then finish off with Q&A. So, yeah. Lynae, over to you.
Thank you, Leslie. Welcome, everyone. We appreciate you being here during your busy work week, and we're going to talk all about eggs. So this is Eggs 101, so just sit back, relax, and we will inform you a little bit about egg freezing. So the question is, what happens as we age? We all have heard that there's something called a biological clock, and I actually detest that term. But it is true that we have decreased egg quantity as we age. So we are actually born with all the eggs that we'll ever have. And we're born with about 5 to 6 million. And then as we are born, actually before we're born, we make 5 to 6 million. By the time we're born, we'll have about 1 million. And by the time we go through puberty around the age of 12, we'll have about a couple 100,000, like 300,000 or so. And then by the time we hit menopause, when our periods stop, we'll have about 1,000. So between puberty and menopause, this is your reproductive lifespan, okay? And this doesn't look the same for everyone. We don't know how many eggs you were actually born with. This is an estimation that's based on evidence from studies, but we don't know how much an individual is born with and how quickly that quantity will actually decline. And we know that as we age, not only does our quantity decrease, but also our quality. So we don't know the optimal age for you to freeze your eggs, but we think that there's good egg quality or best egg quality between your early 20s and mid 30s. And that's based on some data that's published that says that egg quality is probably highest and peaks in that time. And what does egg quality even mean? What it means is that that egg can actually be fertilized and it can develop normally. So that's egg quality. But often we can't tell the quality until we've actually tried to fertilize the egg. But at Ovum, we're going to tell you what we do to suggest quality or to look at quality beforehand. So again, as we age, not only does our quantity and quality of eggs decrease, but also our pregnancy rates. So pregnancy rates are related to egg age. So I want to draw your attention to the orange line. As we age, our egg quality decreases. So at 35, we have this exponential decrease. And there are some reports that even your fertility starts to wane at 32. So you can see that there's a purple line where the pregnancy rates don't decrease exponentially. Those are people who've used donor eggs or eggs of young women. But when you're freezing eggs, you can be your own egg donor so that you can use your own eggs, biological eggs, in the future, versus using an egg donor who won't be biologically related to you. So even if you freeze, let's say at 32, your eggs will always be 32, and you'll always have the pregnancy rates of a 32-year-old, even if you try to become pregnant with those eggs at 40. So now let's talk about the process. There are lots of misconceptions about what you actually have to do to freeze your eggs. Let's go through it step by step. The first thing you need to do is have an initial medical consultation, and we'll go through what that is. The second thing you would need to do is have diagnostics, and then have a follow-up consultation to go over those diagnostics. Once you're ready to go through an egg freezing cycle, then you would have a nurse consultation with one of our nurses. And then once we've ordered your medications, you would go through stimulation and monitoring. Okay, I'll explain what that is momentarily. The most important step is step 6. This is your trigger shot. This makes sure that your eggs will become mature. And this is what we need to freeze. We can only freeze mature eggs, not immature eggs. And the last step is the retrieval and freezing. And this is where Ovum is different. The whole process takes about 3 to 4 weeks, so plan on a month. And you don't have to take off the entire cycle. You only have to take off on step 7, the day of the retrieval, because you will have anesthesia, and you'll need to come into our clinic for monitoring in step 5. Okay, let's talk about the initial consultation. So one of my colleagues, who's also a reproductive endocrinologist, will go through your medical history, your family history, your medications, either in the comfort of your home through your computer or your phone, or you can come in person to have a consultation. And then we'll do diagnostics. And in the course of diagnostics, we need to do 2 major things. We need to do an ultrasound, or it's called an antral follicle count, or AFC for short, where we'll look at your uterus. We'll do a 3D scan of your uterus to make sure there's nothing there that you need to be concerned about, such as polyps or fibroids. And then we'll also look at your ovaries, and we'll measure your ovaries. So these are ovaries, okay? And we'll count the antral follicles in your ovaries. That means those are the sacs where the eggs develop. And they look like holes, but it's actually fluid around the eggs. And it helps us to know what your stimulation will be like. It also lets us know that we can get to your ovaries. Not all the ovaries that we see are actually accessible. And then we also do anti-Müllerian hormone. And anti-Müllerian hormone is a marker of ovarian reserve. It just allows us to understand how we should dose you and what to expect in terms of your stimulation. After you've done your diagnostics, you'll have a follow-up consultation. You can do that again from the comfort of your home or come into our office, whether it be in London or in Portugal. And what the purpose of this consultation is to go over your diagnostics. And this is included in terms of the pricing with your initial consultation. We'll also set the plan in terms of what medications, the dosaging, and we'll go over everything with you in this consultation. And the purpose of your nursing consultation is now to give you explicit instructions about how you will take the medications, okay? You can ask questions, you can review our videos that have already been made for you going over how to take the medication, what to do, when, and we actually will communicate with you via our app and give you a calendar so you know exactly what to do and you're never left alone. You can do this, again, in person or in the comfort of your home. And so for the stimulation and monitoring, this is a 10 to 14 day period where you'll come in at least 3 times, and you'll have blood work and ultrasound to determine how you are responding to the stimulation. And then once we think that you've stimulated enough, you'll take the HCG trigger. There's different names for this, but essentially what this does is it actually matures your eggs so that we can freeze them. And everything that we're doing here is similar to what's happening in the menstrual cycle. And I'll go over that in the Q&A a little bit as well. So the sentinel event is now the retrieval, okay? So the egg collection is performed under anesthesia. So you will have some what we call twilight sedation, and you'll be asleep, but you'll be able to respond to some commands, and then you'll sleep very heavily. And so it's a 20-minute procedure from start to finish, but you'll be asleep for about an hour. And the reason you need to go to sleep is because we put a very large needle through the vagina, you can see here, and into the ovary, and we aspirate each of these follicles. And what happens is that your ovary and panel A, which is unstimulated before you start a cycle, now becomes stimulated with something called gonadotropins, which is what we prescribe. And the gonadotropins, what they do is they rescue the follicles that normally would not make it. So in your menstrual cycle, you have a cohort or a group of 10 to 12 follicles, and normally and naturally, you have only one follicle that becomes the dominant follicle. But now when we give you medications, we're rescuing all of these follicles so that they can all become dominant follicles, and then your ovary goes from A to B. And these follicles go from small, as you can see here with the arrow, to very large. And that is what the physician will be aiming for when they go in with the needle to aspirate your eggs. And this is what a human egg looks like, okay? And this is what our embryologist will be using in the lab and looking at in the lab. And then you get immediate results. The embryologist will be counting and letting us know how many eggs you have on the same day. So how many eggs do you get in a retrieval? It depends on the person. There's some data from about 350 cycles that says based on your age, you may have a different yield of eggs. So for instance, if you're 33, we would expect that maybe you'd have somewhere between 8 and 10 mature eggs. So not all the eggs that we will retrieve will be mature. And again, we can only freeze eggs that are mature. So are all eggs the same? No, they're not. So if you went to the supermarket and picked up eggs, you always look at them, okay? And some eggs look a little bit weird. Some of them are chipped. Some of them might have spots. Some of them might be small. And that's the same with human eggs. So this is an ideal egg. So this is an egg that has what's called a polar body, which is just a packet of excess DNA. And then it also has a beautiful eggshell or a zona pellucida. And this is the ooplasm or the cytoplasm of the egg. So this one is ideal. But some eggs have very severe phenotypes. So they have what we call vacuoles or cysts. Some of them have very large and stretched out zona pellucidae. Some of them have a very large polar body. And these are probably eggs that won't yield a pregnancy. And in most clinics, that's what they can tell you. Your eggs look ideal or they look suboptimal. So how many eggs do you need to get pregnant? Well, that depends. It depends on your age. So if you look at this chart, this is data from a large IVF practice in the United States. This particular chart suggests that on average, women need 15 to 20 eggs to become pregnant. And this is not really based on the quality of the eggs, it's just the numbers. So if you look at this chart and you're less than 35, then you would be about here, okay? To have a 90% chance of a live birth, you need to have about 20 eggs. But again, this is just a guesstimate based on the quantity. And so the average survival rate of eggs is 70 to 95%. So that means the majority, but of course that varies based on clinic to clinic. So let's talk about the technology. I hinted at this before, but I now want to go over it. So instead of just being told your eggs are optimal or suboptimal, we actually have a computer vision algorithm that tells you data about your individual eggs. So I'm not sure I can zoom in, but I'm going to try to zoom. Here we go. We're zooming in. So this is a fictional patient. This is not an actual patient, but you would get a similar report to this, and it would show you what your score is. So the score is based on a scale of 1 to 10, 10 being the best scoring, 1 being the lowest scoring. So you can see here that this fictional patient had an egg that was mature, so it's got the polar body, and it had a good score. Anything over 7 is a really good score. It had a score of 8.1, and it was frozen. The next egg had a 9.0, and it was frozen. This egg had a 2.0, so anything under 7 is likely not to yield a live birth. And how do we make these scores? Well, we're comparing these eggs with our computer vision algorithm based on women who've gone on to become pregnant with their eggs or women who've not gone on to become pregnant with their eggs. And we're looking at how the light scatters, the clustering of organelles, or basically the basic machinery of the oocyte or the egg. And we are comparing, again, on a scale of 1 to 10. So before you freeze your eggs in our clinic, you have a sense or you have an idea of the quality of those eggs. And at the very end of the report, you'll see how many of those eggs, when you come back and use them, how many of those will become what we call blastocysts. So we've abbreviated here BLAST. But a blastocyst is the most developed form of an embryo that we would transfer to your uterus for you to become pregnant when you come back for your eggs, if you come back for your eggs, okay? And you also get an estimate of what your chances of live birth are. So not pregnancy. Pregnancy is just the state of being pregnant. But live birth is when you actually have a baby, whether via vaginal birth or C-section. So you'll have an idea of the cohort or the group of eggs that are actually retrieved, what your chances of live birth will be for 1 baby and also for 2 babies, okay? And that's just bigger so you can see that here. Okay, so now let's talk about how we store. So in most traditional clinics, the old school approach is that somebody puts your eggs after they've frozen them in what we call straws, which are just little, literally straws where the eggs are stored, and then they're plunged into liquid nitrogen. And they're labeled with handwritten labels that are paper, and there's manual storage and retrieval from these huge, huge tanks that you can see here. And there are reactive alarms if this level of liquid nitrogen, which is this sort of haze you can see coming out of the tanks, if the liquid nitrogen gets low, then some type of beep will go off and alert the embryologist, but only once it gets low, which potentially can compromise the storage of your eggs. And you have really no access to the information of the temperature, who's monitoring it, how often it's being checked in real time. Now, let me explain to you what we do that's different at Ovum. So we do everything with digital labeling. So we know where your eggs are. It's fully automated. There's 24/7 monitoring with more than 1 million daily checks compared to only 100 checks with the old school, okay? And you have access to this information in real time. So instead of storing your eggs in one of these big containers with liquid nitrogen, we store your eggs in a robot. And this robot has a little panel here that scans the iris of our embryologist. So I can't access this robot. Our janitor can't access this robot. Only the embryologist who is assigned to you on the day of your retrieval and the embryologist who's assigned to you when you come back for your eggs, okay? And instead of storing your eggs with everybody else's eggs, Miss Patel's eggs, Miss Smith's eggs, your eggs are stored in their very own compartment, no roommates, okay? So I'm gonna show you a little video of our embryologist putting eggs in our robot. So the robot's actually quite big compared to what you see on the screen. And we're putting your eggs into their own compartment. And again, very secure, 24/7 monitored with a team in New York. And then we have on-site security as well. And if there was any abnormality, everyone in the clinic becomes notified. So let's talk about the future, because I think sometimes when we talk about egg freezing, we only talk about the event of freezing your eggs. We don't talk about what happens when you're ready to come back and use those eggs. So let's talk about that here. If you decide to freeze your eggs, you will have to have IVF to become pregnant if you are going to use those eggs. So we already stripped the eggs to freeze them, and so you would have to have ICSI to have them fertilized. And you can see what ICSI is on the right-hand corner. So ICSI is intracytoplasmic sperm injection. So we inject sperm into each of the eggs individually, and that can be sperm from a partner, a spouse, or a donor. And this is how we would fertilize the egg so that we can make an embryo. This is an embryo, blastocyst. This is the same prediction that you'll get from our oocyte ovum intelligence or egg intelligence. And this is a blastocyst, and this is what it looks like. And then we put it in a catheter, and that catheter is then put into your uterus. And that is where the embryo is. And then we give the embryo a little push, and then it's put into your uterus, and hopefully you become pregnant. So that's the future. All right. And so how do we support you through this entire process? We have a support app. And the whole purpose is that you don't have to wait for phone calls or come into our office needlessly. We try to communicate with you and support you through the app. You don't have to check for emails. You get regular updates. So let's just say you froze your eggs and you wanted to know what your egg quality is. Well, the next day after your retrieval, you would meet with an embryologist via our app. They would show you that same report that I just showed before, and they would go over it with you, and you don't have to take off from work. You can do that on your lunch break. And that's how the app is supportive. Also, let's just say that you had all of your diagnostics with your gynecologist or through your GP, and you wanted to upload them. You don't have to fax, you don't have to email, you can upload them through our app. And that's the benefit of using our app. And then when you're done, you get a little summary of everything that's happened. And so let's just say you move, I don't know, somewhere to, let's say the Maldives, and you want to have your eggs sent there. We can send your eggs to you, and you would get all the confirmations through the app as well. So you can book appointments, you'll get personalized notifications, medication reminders, you'll get information to your own reproductive health data, and you can always connect with us during our business hours in the app. And if you had any questions, we'll get back to you next day. And if you had an emergency, we do have an emergency number outside of the app. Okay, let's talk about research now, because egg freezing is something that's been experimental. It was experimental until 2013, and now it's become more mainstream, but there's a lot we don't know about eggs. And at Ovum, we're pushing the envelope to find out more about egg quality so that we can tell people more about the eggs that they're freezing. So study number one that we're actually doing a webinar about this later in the week with GlycanAge, our collaborative partner. And what GlycanAge does is they actually test glycans, which is a marker of aging, and they can tell someone their biological age. And what we are trying to understand in this study is how those glycans, or those products of aging, relate to ovarian aging. Because as I showed you, the ovary, as we age, you have less egg quantity, and then you go into menopause. But we don't know when people will go into menopause. We don't know how someone's ovaries age very quickly and someone else's don't. So we'd like to know more about the aging process and how that relates to glycans. So that's an up and coming study. And if you're planning to freeze your eggs with us, you can contribute to science as a citizen scientist in one of these studies. The other study that we're doing is looking at egg quality. So we want to understand something about the powerhouses of the cell. So if you remember back in high school biology, the mitochondria are the powerhouses of the cell. Well, it turns out that they're very important in egg quality, but we don't know much as a field about it. So at Ovum, we're doing the necessary research to understand more about egg quality so that people know what they're freezing ahead of time, besides just the computer vision that we are already doing, which is already ahead of the field. So let's talk about payment now. Everybody wants to know, how much is this going to cost me? It depends. So everyone will need to have an initial medical consultation. Again, this is the time for the physician to go through your medical history. You'll get a questionnaire ahead of time through the app so that you can fill that out, and we can have more of a conversation as opposed to just us asking questions. We can actually develop a plan if you already have your diagnostics done. If you still need diagnostics, we're more than happy to do that. We can do the antral follicle count. Again, that's where we look for the sacs where the eggs grow in, and we're looking to see how many you have, and as well as an anti-Müllerian hormone, or AMH. Again, that's the other blood test that we do, and that's a marker of ovarian reserve. And then this price here, this $330, is access to our digital app as well. So you can do blood screens with your GP, or you can do them with us, but we do need HIV, hepatitis B, hepatitis C as well. And if you're cycling in Portugal, you'll also need syphilis. So again, you can see the prices as it would be in Portugal versus the UK. If you did one cycle of egg freezing, it's about 3,250. Okay, that's pounds. You can see the euros in parentheses. If you did 2 cycles, there's a discount. If you did 3 cycles, there's even more of a discount. And the number of cycles you need really depends on your goals. Do you want to have 1 child, or do you want to have 5 children? So it depends on also how you stimulate, and it depends on what is able to be frozen. Okay, so the monitoring, you need to come in at least 3 times. That's 360 pounds. And the medication, we usually give it in ranges, but the average will be 1,500 pounds for medication. Depending on where you live, you may be able to get it cheaper, but you should plan for about 1,500 pounds worth of medication. And then in terms of the cryo storage, what that means is that we are billing you to store your eggs in our robot. And so that's 450 pounds yearly, or it could be 40 pounds per year. So you can see the average total cost is about 6,000 pounds. But don't fret, Ovum is all about accessibility, and we understand that that's a lot of money. And so we have financing options available, as well as a free financial consultation to go over those. So let's talk about financing options. Pay as you store. This is a new program that we've started. And what it means is that we will go over what your chances are of and how many eggs you will get. And then you have the option to have a low upfront cost and then do a minimum storage period. And then you can finance part of your treatment over time. And we're more than happy to talk to you about what that means. So instead of you coming out of pocket for $6,100 all at once, it'll be an upfront fee and then a fee over time. Okay, now let's talk about how many eggs will you get. Well, it depends on your diagnostics. And so we do have a oocyte retrieval prediction, and we can show you what we think you will get. And then from that, you can have an idea of how many cycles you will need and how many babies you want to have in the future, potentially. And so this allows you to have, again, an idea ahead of time. So you're not walking into this blind. Okay, we can open it up for questions, but I wanted to go through some frequently asked questions. So I said this before, but in case you didn't hear, will I need to take time off work for the entire process? Absolutely not. We want you to continue to work, and we try not to disrupt your life. This is why we could do most of our communications through the app. You only need to take off the day of the retrieval because you will have anesthesia, okay? But you'll know at least 2 days in advance when that'll be. Next question. When is the best time to freeze my eggs? Well, the optimal time is probably in your mid-20s to early 30s, okay? We think that's when your egg quality is the highest, and that's when the quantity is probably also higher. But it can vary from person to person. And again, the ovary is the first organ to age in a woman, and we do not yet know what the factors are that actually influence that aging. It could be rapid, it could be slow. So when you're thinking about freezing your eggs, that's the best time to do it. How long can eggs be stored? Well, turns out they can be stored indefinitely, thanks to advanced freezing techniques. In the UK, you have up to 55 years to come back for those oocytes or those eggs. What happens when I'm ready to use my frozen eggs? Well, we talked about that a little bit. If you decide you want to use your eggs, you will need to have IVF, specifically ICSI, and the eggs will be thawed and they'll be fertilized with sperm to create embryos, and then the embryos will be transferred to your uterus, and that will hopefully yield a pregnancy. What happens if I do not use my frozen eggs? Well, there's a couple scenarios. If you decide not to use your frozen eggs, you can choose to discard them, so you can just throw them away. You can donate them to an individual, or you can donate them to research to further the field. So it's never a waste. Freezing your eggs is about giving you options, and that's what we are about also at Ovum. So what are the potential side effects of ovarian stimulation? Well, most patients experience mild side effects during egg freezing, such as bloating, that's common, cramping, some mood swings, and some soreness at the injection site. In rare cases, people can develop what's called ovarian hyperstimulation syndrome, which can cause severe symptoms like abdominal pain, nausea, rapid weight gain, and changes in your fluid balance. Your Ovum doctor, though, will monitor you very closely throughout the process to minimize any risks. And one of the last questions I think here is, can I administer the egg freezing medication myself? Yes, you can. So we go through this with the nurse consultation, and the hormone injections, you will know what you're taking, how to take it, and by the second day, you'll be a pro. But again, you'll go through this in the nursing consultations. Most people find it manageable, but if you're uncomfortable, We can offer you additional support and resources, and also you can have a friend or a partner help you to inject. All right, Leslie, back to you.
Thank you so much, Dr. Lynae, for sharing all that information. Very comprehensive and very helpful. So now we'll turn it over to the audience to ask questions. So I will open the live chat now, and then feel free to follow the steps shown on the screen. So click on the little triangle at the bottom right of the screen, click Q&A, and then you can ask a question. So please note all questions will be anonymous, so feel free to ask anything you're comfortable with. I will read out the questions and Dr. Lynae will answer them. So first question, what are the risks associated with egg freezing?
Yeah, so we talked about that in FAQ. So one of the risks is just that you can always have with the retrieval bleeding, injury to bowel or bladder because it is an invasive procedure. But the most common risks to you really are the side effects of stimulation. So bloating, maybe you might have some breast tenderness, you might have some mood swings, but it depends on your medical history. So let me go back to this. It depends on your medical history and also what you've experienced in the past. So I like to tell patients that sometimes think of ovarian stimulation and IVF sort of like super duper PMS. So whatever you suffer from, if you have PMS, you may have a little bit more intensified symptoms during the retrieval itself, or during the stimulation rather. For the retrieval itself, the risk is injury to bowel, bladder, and also potentially any anesthesia risks. So if you do have an increased risk of anesthesia, we'll have you see one of our anesthesia colleagues to see if you have an increased risk and what we would do to navigate that and circumvent that.
Thank you, Lynae. Next question. We have another one. How old can I be to use my frozen eggs?
So that's a really good question. It'll vary from clinic to clinic. We typically tell people that, again, you have 55 years to come back for your eggs in the UK. In Portugal, no one over the age of 50, that is 50, so 49 and plus 11 months plus, can have any type of transfer. So it depends from country to country, but you could, in theory, come back for your eggs at any point. There are guidelines, clinical guidelines, that you should still have a period, but there are also some loose guidelines that say that there should be a combined parental age of no more than 100. So it depends. It also depends on your health and many other factors.
Great. Next question. That's an interesting one. Can I do genetic testing on my eggs?
So that's a really good question. We don't typically do genetic testing on the eggs themselves. You may read online that there's been something called polar body biopsy that we don't do anymore. We do genetic testing, though, on you. We can do carrier screening testing to see if you carry any mutations. And then we can also do screening and testing on the embryos that are made from your eggs. Because remember, it's eggs plus sperm to make an embryo. And then we can take a little tiny cells in the area that's called the trophectoderm, or the area that will become the placenta. And then we can test those to see if your embryo is what we call euploid, meaning it has the correct number of chromosomes.
Understood. Next question. Can I move my eggs to another country after I freeze them?
Absolutely. But keep in mind, you should check the local laws and regulations of that country. So in some countries, like in Switzerland, you cannot have your eggs until you are married. So you may not want to ship your eggs there unless you are abiding by the laws of that land. So check local regulations, but yes, we can ship them anywhere. There are couriers who will curry them at negative 198 degrees Celsius. So that's the temperature that they're stored in. That's the temperature of liquid nitrogen. And so they will stay frozen. There's not a risk of them unfreezing during transport. But, you know, if there was a mistake, there's always a possibility of that, but likely they'll be transported by a professional service that has either embryologists transporting them or people who are trained to do so, and they will also have insurance on your samples. But it's very, very rare that there's any issue with your eggs thawing out ahead of time. And the cost varies from place to place and the distance how they're transported or over which they're transported.
Great. We have a lot of questions coming in. Feel free to share them. Next one is, do you have an age limit for freezing eggs if you don't want to use donor eggs?
Do we have an age limit for freezing eggs? So we don't have an age limit, but we tend to discourage people from freezing over the age of 40. We think that the egg quality is compromised at that time. Again, not everybody who's 40 will have ovaries that act like they're 40, but that's a general guideline. We would say at that point, it's probably better to make embryos over the age of 40. So you can make embryos with donor sperm and freeze those embryos for a later day, or you could become pregnant. But we don't have per se a hard and fast cutoff. We just tell people that, you may not be able to retrieve those eggs. They may not thaw, they may not warm. If you're over the age of 40, it's better to go ahead and fertilize them. This is almost like testing the quality of the eggs ahead of time. So we don't want people to be disappointed when they come back for those eggs. And then there was a second part to that question. What was the second part again, Leslie?
Do you have an age limit for freezing your eggs if you don't want to use donor eggs?
So if you don't want to use donor eggs and you're over the age of 40, again, we would say have a retrieval, but make embryos instead of freezing your eggs.
Great. Next question is, where are your clinics located?
Yep, we have a clinic in London, central London, off the Victoria line at Euston. So it's about a 7-minute walk from the Euston station, about 10 minutes from King's Cross. And then we are opening a second clinic in the greater suburbs of Lisbon in Cascais, and it is going to be opening at the end of November. So stay tuned. We do have a waiting list that we are putting together. So if you'd like more information, feel free to reach out to us and we'll put you onto that waiting list, and we'll tell you how to reach out to us in just a second.
Exactly. Next question. How does lifestyle affect egg freezing success?
Yeah, that's a great question. So the first thing I tell people is if you're doing things that are toxic, remember your eggs are super precious and they are exquisitely sensitive to any toxicant. So if you're smoking, stop, because that will definitely impact your fertility in the long run and also potentially your egg quality. If you are not eating a healthy, balanced, plant-based diet, start, because this is extremely helpful. And remember that the powerhouses of the cell, or the mitochondria, they respond to vitamins and nutrients in real time. So you can actually eat a really balanced diet. Now, there's some data that says, oh, you should wait 3 months. No, remember, your eggs are living, breathing, literally, we call it oxidative phosphorylation or oxidative respiration in the mitochondria. They're literally responding to everything that you do. So just start now. So start eating well. If you're exercising, that's also potentially improving your metabolism, which is what the mitochondria do. I think there are lots of things that you can do to improve your overall success. And there's no magic pill. There are some supplements that we would recommend, such as CoQ10, which is a cofactor, again, for mitochondria. And at Ovum, we do work with a fertility nutritionist to help you go through all of what you're eating and also your supplements to make sure that you're optimized. But again, that happens in real time. What was the other part of that question, Leslie?
Just any lifestyle advice.
Yeah, try to get really good sleep. Before you go through a cycle. You can be, I think a lot of people not only feel the bloating and the moodiness, but sometimes quite tired. Remember, you're making eggs, so you need good nutrition, good sleep, good rest. And in terms of the lifestyle, you want to try to minimize the stress that you have while you're going through the cycle, not so much because it can impact the eggs, which of course all stress potentially does affect us biologically, but also for you, just for your mental health, so that you can be as zen as possible when you're going through a cycle of egg freezing.
So we have time for a few more questions. Next one is, what is the difference between egg freezing and embryo freezing?
So an embryo is a fertilized egg, and an egg is not fertilized. So that's the difference. We're freezing an egg that's unfertilized. It's a single cell versus an embryo, which is now a fertilized egg. So we've introduced sperm to it, and that is now multiple hundreds of cells. And usually we freeze blastocysts, and those are day 5 embryos. So that's the difference. Eggs are unfertilized. They just have the genetic material of the person that we've retrieved them from. And the embryo is not only the genetic material of the person we retrieved from, but also the sperm combined with it to make an embryo. If you're making an embryo with your partner, remember, the embryo belongs to the couple, not to you. And if you're freezing eggs, your eggs belong just to you.
Great. Another question. Is there an age limit for embryo freezing?
Is there an age limit for embryo freezing? There is no age limit for embryo freezing, but again, depending on where you would have your care, if it was in London, we would like you to have a combined parental age of no more than 100. And if you are now, let's say, making embryos and then freezing them for later, you cannot have a transfer after the age of 50 in Portugal. That's important to remember. So in theory, no, there's no limit. But in practice, yes, there is a limit, and it depends on your locale.
Next one, going back to your clinic location, do you have any clinics in the US?
No, we do not have any clinics physically in the US, but we always welcome American residents and American citizens to come to London and Portugal. It's about 30% cheaper in London and almost 40 to 60% cheaper in Portugal, even with flights and hotels to get your care. And you'll get American standard care because I'm the chief medical officer and I'm American trained. And also my colleagues follow practice guidelines and evidence-based medicine as well as all the technology that you may not even find in the US.
Another question on travel. Is it safe to transport eggs from country to country?
It is. As I talked about before, we use professional cryo transport services. So in some of those services, your eggs could be transported even by an embryologist. But usually they're transported from place to place without any issue. And again, the companies have a liability insurance. So if something happens, they would have to reimburse you if there was anything that occurred.
Great. Feel free to share more questions on the screen. We have 5 more minutes to answer them. Next one is, how many cycles might I need to freeze a sufficient number of eggs?
That depends. It's something that we would discuss in your medical consultation. Depends on your age, depends on your medical history, depends on how you do with your first cycle as well. It depends on your wish for your family size. Again, if you want to have 1 child, we're having a very different conversation than if you want to have 4 children. In general, the consensus is that you need to have 15 to 20 eggs, but again, that doesn't take into account egg quality. And it's really quality, not just quantity of eggs.
A follow-up question on lifestyle. Do cardio workouts adversely affect egg quality?
I don't think we have any evidence that it does. In fact, cardio workouts more than likely are very good for you because it's helping you to build muscle mass and decrease your insulin levels and decrease your average glucose levels. And that's what we want to happen for adequate metabolism. Now, there's such thing as working out too much. And this is something that we can discuss again in the medical consultation.
Great. I have a few more questions. Can I combine egg freezing with IVF?
So not sure what that question means. You're gonna have to ask that question again, but what I think it means is, can you freeze eggs and freeze embryos? Or am I wrong in that question, answering that question? But if that's the question, the answer is that yes, you can freeze eggs and at the same time make embryos with some other of your eggs and freeze those embryos. Remember, the eggs belong to you, the embryos belong to the couple. If you're using a sperm donor, of course, though, the embryos and the eggs would both belong to you.
Feel free to ask any follow-up question if we didn't answer your question. Last question. Okay, I can see. Can egg freezing guarantee a future pregnancy?
There are no guarantees in biology. So this is not insurance. This gives you options. I like to think of egg freezing like the birth control pill. Birth control pill is not 100%. You use it to allow you to have children when you want to. And that's what egg freezing is like. Again, it's not 100%, it's not insurance, but it gives you the option.
Okay. Oh, another question came through. Is egg freezing covered by insurance?
It depends. You have to check with your insurer. We wouldn't be able to answer that. So the best thing to do is either call your benefits coordinator through your job, or look up your insurance and call your insurance directly and ask if anything is covered, such as diagnostics or medications. But this is something that we would like to accept in the future. We'd like to accept insurance in the future. We don't do so at this time. But we can give you information so that you can become reimbursed by your insurance.
Great. Well, that's all the questions we seem to have tonight. So thank you so much, Lynae, for joining and for sharing all that helpful information. We'd all like to share a little gift before you go. So if you go to the next slide, we'd like to offer everyone a free one-on-one meeting with Dr. Lynae Brayboy if you're interested to know more and to discuss your personal circumstancing and personal goals privately with Lynae. And we'd also like to offer you a free one-on-one meeting with our co-founder, CEO, and patient advocate, Felicia, to go through any question you may have on our pricing and flexible financing option. So please check your inboxes after this webinar, and we'll send you a link to book with Lynae and Felicia. Well, thank you all so much for joining us. It's been a pleasure having you. We look forward to seeing you again, and have a great evening.
Yeah, thanks for coming, everyone. Take care. Bye-bye.